She went on to obtain a master's degree in education, and she's passionate about children, Peru, and Pisco. Welcome, Susana.
Hi everyone. Thanks for the invitation.
Susana, we always start the podcast with the same question. Why did you become a pediatrician?
Since I was a little child, I think I got like many short diseases, or I was weak in my health. So I was always in hospital or the ER. My parents were always taking me because I have some rash or I have some kind of strange fever. I was getting all the time, and I was seeing around me many other children that were also sick, and I got very curious about that. And I think that because of the curiosity of seeing what happens to little children around me as I was also sick, it leads me to do this specialization in pediatrics.
Wow. So did you say you saw a lot of little children that were sick or with autism?
Sorry.
Did you say children that were sick or with autism?
No, we are like, with, I don't know, broken bones or intoxications or fever. In Peru, we have ER that are like for general things. So I remember very well that I got intoxicated with the ingestion of any kind of candy, strange candies, and I got like a big rush. Yeah, in Bulgaria, and I was seeing around many other children sick with a broken bone and maybe Pfizer, and then other around me, and the parents also come with their child.
Oh, wow. And
Yep.
then what is residency? I was curious because the hospital name, it says Madre Hijo. So is it a woman's hospital and a children's hospital?
Yeah, it has both at the same time. You get the pregnant woman like it's going inside and she's in labor, and then the baby borns, and then the pediatrician gets there. Yeah, so they have the combination of pregnant woman in labor and also the pediatrician there. Even the residency of the gynecologist, they do 1 or 2 months in every year of the specialization with us, because they learn how the newborn goes through the first hours of born or the first days of being born. And I think they get a bit more aware of what is to have a new life, because sometimes just take out the child and you take it there with the pediatrician. Yeah. But now that they are doing some months with us in every year of residency, they might see what is important, and also being aware of the new life. Like we do care of them. Yeah.
And
So
and how many beds, how many pediatric beds does the hospital have?
in my hospital where I work now, it's a small, it has 12 floors, but only one floor is for pediatrics. And in general pediatrician, we have 10 beds for normal hospitalization. And we have 5 beds for like intermediate with dehydrated or sizers. Like they can't go inside yet because they are still in that, because we have to take care or take a close look to them. We have 5 of them. But upstairs, we have the newborn, we have 5 to 6 intermediate for newborns if they have not like depression for when getting born, or they are dehydrated, or they come from outside with a pneumonia related. And obstetrics, they have 15 beds with the newborn there. So when you pass the visit to the patient, you get also the woman with the baby, the newborn, and you take that.
Okay. So they do it like in the US. Because we're talking to Dr. Morales in Ecuador, and he said in Ecuador, they take the baby into the nursery for 3 days and separate him from the mom.
Well, that's a
Yeah.
very new thing. Yeah. Now here, as you said, my hospital, the hospital where I did the residency, they call it like mother and child hospital, because we try to put at first place the link that they get together, the mother with the child in the very first instance of being born. No, what we are trying to do, and I think it generally in Latin America, is to put them together, no, to try not to take them by separate for the milk formula feeding or something. No, just take them as close as you can. Even in C-section, you put over the mom to,
So in Peru, they are advocating strongly for breastfeeding first.
yeah, yeah,
Yeah. Okay. And the maternal infant bonding right away.
yeah.
How long? When I was in Costa Rica, I don't remember how long, but I think that the mom that delivers stayed like for a week in the hospital. How long do they stay now in Peru?
In my hospital, if it's like level birth, you take out like 1 or 2 days top.
Okay.
But in section 3 days is out.
That's the same as here, 24 hours. I thought that was just out of the feet fast, but that's how that we do it here. And how do people pay for healthcare in Peru?
You mean to be paid as a doctor?
No, do they have a socialized, like a social security
Yeah.
program, private
Here,
insurance,
you have
self-pay?
you have many options here. For example, yeah, I work for the social insurance. I think people, how do they get there? They have to be working for someone, and that someone makes a contract for you, and a percent of your payment goes to this secure, the social insurance. And then they can get attended there, the main worker, the wife, and the children. That's, I think, the best insurance here for people that are not that wealthy or not that poor, like medium. And also you can have, yeah, if you don't work, you are not that very well incomes, or yeah, let's say poor or something. The state, the country makes a special insurance, but it's not that good because, yeah, of course, the person doesn't pay anything for the country, but the country they say that they pay for everything. But when you go there, then you don't have needles, you don't have the alcohol, you don't have
Oh,
anything to
wow.
do. So the patient tends to buy many of the things that the doctor or the nurse needs to heal you, let's say. And then
Mm.
there's another way that you are like, if maybe wealthy person, then you can pay your the consult or the doctor directly. And then for example, I heard that in Europe, when you are pregnant, you get in labor, you have to push or you push. But here you can decide, no, I really want a C-section. And then you go to the private and they say, okay, yeah, you can pay your C-section, let's say $10,000. Yeah, no, now. And then the woman go or the father goes and pays, and yeah, that you get your C-section. No, but that's the private, very private side of the health system, the way you get a pension.
And I see sometimes on your Instagram account that you're doing house calls. Is that private patients that you go to their houses?
Yeah, that's private. Yeah, because
Oh,
for example, now we are getting to flu season, and I also apply vaccine, and people say, "Yeah, I need the flu vaccine here," and then they say it's 4 of us, family of five, and then I go there. Or for example, my baby has fever. Can you go there? And I like take all the time take an agenda like to say, "Yeah, I am free at this hour now." So now, for example, another said, could you please put me the flu vaccine now at the afternoon? But I have work at the hospital and at 5 or 6, I can be at your house 6:30. And he says, yeah, it's fine. Yeah. So that's what I do for private, because in hospitals, we don't have that kind of service. It's only by phone. People, the moms tell me when they go to the hospital and they say, yeah, I called 117 and they said, yeah, you can give, I don't know, medication for fever, ibuprofen or something, but just by phone. They don't
they
send
don't
a
see them.
doctor. Yeah, that's
Okay.
maybe it's expensive for them to do that or to have a doctor that works that way. But
And how do you buy your vaccines? Do you buy the flu vaccine? Do you buy the from Sanofi? Do you you buy them from Sanofi?
I used to do that. He was here until this year. Then they said
Okay.
goodbye. And they just, I don't know.
No.
Yeah, but now I am working with the vaccine of Abbott.
Okay.
Yeah.
You buy it from Abbott and then you take it to the house. You charge for the consult, and then you
Yeah.
charge them. Then you
And
charge them
also for
for the vaccine.
yeah, that's what they say that, yeah. Because it's different that they come here to look for me and then apply it here at my house or my house
Okay.
or my office. Yeah. And it's different if you go there. So if I go home of someone's home, yeah, I have to apply an extra charge. That's how it works.
Okay. All right. And then that's just so interesting. Do you, other than the flu vaccine, do you apply other vaccines?
Yeah, now it's full for flu. Yeah, but then I have just put yesterday, or I have applied yesterday, vaccine, which is for 4 years old child.
Okay.
Yeah, and I
Mm.
think they have. Yeah, last week I put papilloma virus. Yeah, for a couple of teenagers. It was a boy and a girl. And pneumococcal. I put my parents in, and even and some elderly people there. And so it's a full variety of vaccines that I can get access to.
And if you don't have a private doctor, then do you go to a clinic where they vaccinate you?
Sorry?
If I can't pay for you to come to give my child a vaccine, where would I get the vaccine?
Oh, yeah, there's people also that vaccines here are expensive. For let's say the most expensive like it was the papillomavirus, which is for us it's 550 soles, which can be $150, I think, maybe.
Yeah.
And flu, for example, it's $30 during the conversion. Yeah, but there's people that can achieve that. But the flu here, then the one that I have or the one the other pediatrician have that work for in private, it's like I have the 4 types of flu and the papillomavirus and like the one that has 9. So in the state they apply for papilloma, the one that has the 4 types of papillomavirus. So yes. So people just put in the should I spend or should I not? If they can't spend on that, they go to the state. That's the one that I told you that the Chile thing, we have it. But now they don't still have it. So it arrives here like in June, I think. So when everyone is already sick, the state really requires that.
Wow. And then how is it like when you go to the hospital, when you go to your job, how does that look? When you go to the hospital, like when do you go? Do you go from 8 a.m. till 2 in the afternoon or when
Oh,
can you
yeah.
have?
Yeah, from where we go. Yeah. Since pandemia, they have changed, because before we used to go to the ER from 8 a.m. to 8 p.m. Or if you do night shift, you do it from 8 p.m. to 8 a.m. in the morning. So in the night shift, you start in the ER from 8 p.m. till 11 p.m. And then with the other pediatrician, because we do in couples, we speak. Yeah, I go to sleep first and then you just stay there and then you stay there for everything, for children with a fever, children, I don't know, with asthma or the newborns. They call you, oh, it's the baby's about to born. And you go upstairs, you get everything from 11 p.m. till 3 a.m. And then at 3 a.m. you go to sleep and the other one comes downstairs to get the other thing. But after pandemic, we changed the times. You start at 7 a.m. So 7 a.m. to 1 p.m. or 7 a.m. 7 p.m. if you're full the shift. But if your health is 7 a.m. to 1 p.m., then you go home. But for example, for me that I go 2 p.m. till 6 p.m. and then till 6 p.m. to 8 p.m. we do administration things, but it's like they give you, here's a complaint for someone that has put in bidding. You have to answer about it. And then you get the computer and then you answer here, someone, this is not the way, blah, blah, blah. And then you at 8 p.m. you go.
And do you still have to stay at the hospital overnight?
No, not now since pandemia, because in my case, I applied for the license sign because, I would like not to do, maybe I will return these hours later and then my boss accept that. But I'm better now because sleeping over somewhere else and waking up at 3 so it was so crazy. My cortisol was really high. Yeah, my boss said, okay, it's fine. I asked my boss up high. Now I'm like, nothing that.
Okay. All right. And I was going to ask you, so, and as far as diseases that you see, for example, if you had a child with diabetes, does the general pediatrician manage the insulin in Peru or is there enough pediatric endocrinologists to see them?
Yeah. So I just remember once in my ER, in the hospital where I work, once came, it was not me there, yeah, but it came a child with heart breathing, where she was like, no, it was really, it worked for her. And then it was this time, I think, so they thought it was asthma or they thought it was a kind of virus that was making, the child didn't have wheezing, as I heard. So they said, okay, let's put in on albuterol. So they were having them the nebulization stuff. And then after they had the 3 courses of nebulization, the child came back again to the ER for evaluation. And the child was still like heart breathing. And I don't know, they put some cortisol on the child and then was not good. And then after the 3rd pediatrician, because we worked in the ER, every each 3 hours, when it's the day, 3 hours, they need to change to the other area. It comes the other pediatrician. And after the second one, they said, let's do some, well, we call it here AGA, which is the arterial gas analysis.
Yes.
Yeah, so then they find out it was in acidosis, but it was not that good. But it is not possible this to be the, just because of asthma. And I think that one of the results of the strip of the analysis, it said that the glucose was very high, and it was a skinny child. So why would it be? And we, thanks God, in that year we had an endocrinologist, pediatrician, because pediatricians all week have the chance to do like a sub specialization.
Okay.
And we have cardiology, dermatology. And this doctor, she went through endocrinologist, and she spent 2 or 3 years in a 4th level hospital, which is the highest hospital we have here. We only have 2 of them, so you can do a sub specialization. And she was coming back. And then we mentioned her about the case, and she tended to manage that. But in first instance, you can hydrate the child, but the insulin thing goes by the endocrinologist.
Okay. So they manage it. And do you see this, a Peruvian pediatrician see a lot of autism or attention deficit disorder?
Oh yeah. Now, I don't know. When I was in my residency, I didn't see that much. But when I went out, it was like many of them. And now in pandemia, were much more of them. And as I was reading why, for the cause is not like lively down. It's not the fault of the mother or the father, maybe. Yeah, but I'm seeing more now. Maybe before we didn't see that because we didn't know about the diagnosis. Even, yeah, let me tell you something personal. My husband, I've seen him when I tend to observe him. I see him like every Sunday at 10 a.m. He has to do the watering of the plants here, and he has to take lunch at 1 p.m. exactly. And he has to take a nap from 2 p.m. till 4 p.m. So this, and I was like looking at him, and every time I talk to him, because I tend to talk a lot sometimes, and he's watching on his TV. He's like, and I was listening to me, and he says, he repeats exactly every detail of what I said to him. So I was like, oh. And once I was talking to a neurologist in a 4th level hospital, and I tell him, my husband is like that. He said, yeah, that's faster, girl. And so I think I'm understanding many things of my husband. And sometimes I was thinking, maybe my mother-in-law didn't see that when he was a child, but he was very intelligent. He is, in fact, actually very intelligent. Maybe when we were younger, we had many older child around us, and they grow up and they grow as an adult. But now I think our opportunity is that we know what is the autism, and we can maybe help people to get more socialized. Because, for example, of course, my husband doesn't have many. He's not a guy that talks to many people. He's the soul of the party. He just maybe has 2 or 3 friends. That's it. And yeah.
But he's also an orthopedic surgeon, so they have a different skill set. So it sounds like the general pediatrician doesn't do a lot of screening tests in Peru.
I can see them in the office. I tend to see them because for me, it's classic. It's a child that gets inside and maybe 4 years old, doesn't speak or doesn't communicate, or gets inside without seeing me to the eyes. And not even that I'm looking at him or talking to him, and he's like somewhere else. And it happened to me that moms or dads don't realize that. And I said, your child is not looking at me. He came inside. And he just that's behavior. He's spoiled child. And no, that's not really, maybe not. But when we have the suspect of the autism, we have to send that to the real pediatrician, because here in Peru, he is in charge. And well, in my hospital, the doctor in charge of that is the psychiatrist. So,
and is it easy to see him? If you send a child, will they see him in a week or 3 months or 6 months? How long will they see?
As I get to the high suspicion that he has autism, I send that to the neuropediatrician. He sees it in the same week, and then he applies. I've seen the paper where he puts, you have to do this therapy, this one, the other one, and then you have to come back in 3 months.
Okay.
So they control the child of the autism there in 3 months, maybe. But with me, they come. If it's less than 1 year old, he's coming with me each month. He's older than 1 year old, he comes to me again each 2 months. I tend to see him while I do the other things that I do in general population of children, just weight, and the normal stuff for pediatrician. But the neurological thing, the neuropediatrician sees it every 8 months or every.
Okay. And so when you say you see them every month or every 2 months, is in private practice, your patients,
Because in
not at the
hospital,
hospital.
no,
It's
no,
just in private.
hospital, they give you 12 minutes to see a child. When I get inside at 2 p.m., I will have a list already of 20 patients and possibly 5 more, which are the additional that they can give you. Yeah. And so we don't have time. When the mom comes to hospital, says, I have a list of problems. And I say, yeah, you have to rewrite that and give me the top 3 of them because I only have 10 minutes for you. So yeah, we have to do it very fast.
Oh, wow. Wow.
Mhm.
And for example, do you see a lot of celiac disease in Peru?
No, that my husband, for example, sees that because he's gastroenterologist in Pediatric. But once someone else asked that to him, I was listening, and he said, "Well, in Peru we don't have that. Maybe we have one, but he's the only gastropediatrician in the one of the 2 4th-level hospitals. He is the only one, and he
Okay.
says even there I don't have that. The other head of hospitals, which I belong there, I'm not in the head, but in the 2nd level, I belong to the other. There,
Yes.
they have more gastropediatricians, and maybe I think that they have maybe 2 or 3, but it's not very common here.
I wonder if it's not common if we don't think about it.
Yeah, maybe it's something that they don't tend to see because they think it's the Mediterranean disease or something.
Okay. And the whole concept of diabetes has changed. When I trained in pediatrics, we used to call it diabetes of the juvenile onset, diabetes del niño,
Mhm.
right? With the typical losing weight, urinating a lot, drinking a lot of water, presenting with, as you described, DKA, which is acidotic, high glucose, and ketones in the blood or the urine. And they're very sick kids. But now that how that whole thing has changed, I was curious if through the community of pediatricians in Peru, do you guys hear about how that's not really the disease that that we thought it was? It's really a immune mediated disease that starts early, like at 2 years of age. Is that something that is being talked about in Peru?
For example, this kind of diseases, they see that only in the subspecialization area. So not in my hospital, but in the head of hospitals there.
Hmm.
But for us, that we work like in the basics of pediatricians, we ask for exams, routine exams every year that includes glucose, blood count, and parasites. And so
Okay.
we try to, maybe we catch someone there. And I remember one that had the glucose of 250 and he was normal. He hasn't been eating something previous the sample. So we send that to the endocrinologist to get bigger exams or further examination.
Okay.
Yeah.
But
Mm.
you don't do a lot of screening other than the
Yeah,
glucose.
no. In hospitals, yeah, we don't have bigger sources or too much money like to invest in everyone to make a very best investigation of any diseases. We only do that every year.
Okay. All right. And what is the best thing about Peru?
The food, I will say. Yeah, every time I have visits from outside, they all the time tell me, yeah, take me somewhere to eat. And I taken people, the last ones that I've had here were some girls from Colombia, were dermatologists, and I took them to, it was a tourist restaurant, but yeah, they were like, oh, it was such a good food.
Yeah, the Peruvian food is just phenomenal. And then you are a connoisseur. You're an expert of Pisco. What is Pisco?
No, Pisco, it falls in the category of the brandy. It's like you take the grape juice and instead of going through the wine bath, it begins to be boiled and they take out the alcohol, which condensates and gets cold and you get a pure kind of pure alcohol. It's not pure alcohol, but it has 40% instead of wine having maybe from 12 to 14% of alcohol. Pisco has 40%. So it falls in fact, in the category of brandy because it comes from the grape, but it calls itself Pisco because of the area that it was created here in Peru, in the south of Lima, which is called Pisco. And for example, the other brandy that it's from cognac, it's especially decided from the French zone of Cognac. Yeah.
And you were trying to explain to me there's three different types of piscos.
Yeah, I do the pure one. We have in Peru 8 varieties of grapes, 4 that has aroma and 4 that has not that much aroma. So you can take from every grape a different type of Pisco. So you can call that pure Pisco. And then
Okay.
you have the mixer. Then maybe you take one from the one that is not that scented or the one that is very scented. And then you mix that and you call that acholado. Here in Peru, being called a cholo or chola, it's a mixture of two different, I don't know, maybe a very white person or with a very indigenous person. The mixture, it's called cholo. So then you have that. And then you have a very, very high specialization, which is called the mosto verde, which goes in the same process of making the pisco, but you cut it in the house. So you can have the sugars not completely through fermentation. And because doing that, it costs us more. Maybe a bottle of pisco is 40, and then a mosto verde is like $70, doubles
And
the
so
price.
80 solas is about $30.
Yeah, but you need
And
more grapes and it's much more expensive. Right.
and I only drank pisco as a pisco sour or pisco sour con passion fruit in Miami. But there's many other, you can drink it by itself.
Yeah, here the people that love pisco, they drink it alone with little shot cup, and in fact, you can enjoy the pisco by itself, but you can do also any other kind of drinks, but especially with the quebranta grape, just not scented, and it has not that much aroma. So when you prepare your pisco, the aroma doesn't win over the full drink. Yeah, that's why they choose that kind of grape. When you mix pisco with ginger ale, for example, and lemon, you can have a chilcano. Yeah, but it has also the denomination of origin. You can't call anything else chilcano but that. If you put the passion fruit, then it's a chilcanal, for example.
Yeah.
It's not chilcana. It has like very many things that we are like in obligation to call them right, because here people that are specialized in pisco, they get like maps if you call it different. So they
Oh,
have,
funny.
yeah.
And why does Chile say that they make pisco?
Yeah, in fact, what they do is not a pisco itself. It goes in different ways. It has two fermentations, and the final result of them is 60% to 70% of alcohol. So they have to decrease that, mixing it with water. Have two different things or ways to prepare this kind of fermentation, distillation. That's why, and they don't have a place called Pisco.
That's
So
right. Right.
yeah,
Right. Right.
we've heard that they have changed a small town of them. They have changed the name. I don't know if in the old paper they have to call it City of Pisco too, right? And we have with a Pisco City, which is very
Oh,
good.
how funny. How funny. Susanna, do you think you'll be coming to the national meeting this year, or will we get to see you next year in Miami with Miami Children's Nicholas when they celebrate their 75th anniversary?
Oh, it's fine. Yeah, my visa has expired. I
Oh
have,
no.
it's easy because I thought it was a frequent traveler. I think the government I actually say my update of it. And hopefully, yeah, I will go there.
Yeah, it'd be lovely to see you in Miami next year and celebrate their 75th anniversary. Thank you so much for your time. And I hope to see you soon in the US or maybe Peru.
Yeah, thanks a lot for the invitation. It was very nice. Thanks.
Uh,